Welcome to another edition of A New Me. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Towson, Maryland, discussing the benefits of wisdom tooth extraction with one of this region's top oral and maxillofacial surgeons, Dr. John Emmett. Dr. Emmett received his DDS degree from the University of Maryland and completed a one-year general practice residency with the VA in Washington, D.C. Dr. Emmett trained for 4 years in oral and maxillofacial surgery at Georgetown University Medical Center and is a diplomat of the American Board of Oral and Maxillofacial Surgery. Welcome, Dr. Emmett.
Thank you very much. Glad to be here.
Oh, it's our pleasure to have you back on our program. You've been on in the past and covered a lot of important topics and issues, and we wanted to have you on today to discuss, obviously, the importance of having a wisdom tooth extracted and all that entails. So I wanted to begin, if I may, by asking you if you can please tell us what wisdom teeth are.
Well, what wisdom teeth are? That's a good question. Actually, the wisdom tooth is the adult third molar. So everybody who enters into adulthood already have their 6-year and their 12-year molars. Okay. But as we get to the 16, 17-year-old age group, the wisdom teeth begin to develop and erupt into the oral cavity. So it's the tooth that's as far back in the quadrants, the 4 quadrants of the mouth, as you can imagine. The reason they're called wisdom teeth is because in the past they thought that the teeth began to erupt into the oral cavity when the person came into their wisdom.
Very interesting.
Which would be, I guess, arguably, but maybe 16 to 17 to 18 years old.
Sure. And what types of problems do wisdom teeth cause?
There are a myriad of problems that wisdom teeth can cause. I would say the major reason that I see patients referred for their wisdom teeth come from the general dentist and or the orthodontist. They refer the patient, as I said before, at 16 to 18 years old, sometimes a little bit later. But mom and dad are worried about the alignment of the dentition after they have spent thousands of dollars having the orthodontics or the braces placed to straighten the teeth. The eruption pattern of the majority of wisdom teeth is on an angulated is in an angulated fashion, and what that does is place pressure against the second molar and against the first molar, and the vectors of force are transmitted forward, in the jaws, and it's the anterior teeth that have very small roots and very conically shaped roots that often get misaligned because of the pressure from the wisdom teeth. Now that, as I say, is one of the main reasons that people are referred for the removal of wisdom teeth to my office and the majority of their oral surgeons around Baltimore. But there are other problems as well. Something called pericoronitis, that is a bad infection. I mean, a very serious infection that can occur around a wisdom tooth. Can it happen in the upper jaw or the maxilla? More often happens in the lower jaw or the mandible. And if you can just use your mind's eye, what happens is the tooth will become partially erupted, i.e. it's halfway through the gums. So now you have a flap of gum tissue over the back portion of the tooth. Well, as you can imagine, food debris and plaque and bacteria and things get underneath that flap of gum tissue. That's called the opercular tissue. And the bristles of a toothbrush can't get to that debris that's under that operculum. Now, the patient can typically live with it. It'll get inflamed occasionally and and go away, and get inflamed and go away. But if the patient should, let's say, for instance, Where it happens is at the 18-year mark, 19-year mark, the patient has their final exams in college, and they get completely stressed out, and their immune system gets run down, or somebody gets the flu, or a woman is in menses. The immune system tanks, and that little inflammation explodes into a very serious infection, which can include swelling of the face, septicemia, which is infection in the blood. You can't get your mouth open, you can't eat, and I put patients in the hospital for pericornitis, so the infections can be very bad.
Yeah, sounds like some serious
problems. Well, it can.
result.
I mean, I'm taking it to the limit, but
Yeah.
you're asking about the complications that
Sure.
can occur, and then just decay on the back surface of the second molar because the wisdom tooth is there. The patient can't keep it clean. It's so far back they can't floss. You know, it's angulated. They can't get the floss in there. Gum disease, cystic formation. I mean, that's a very important point with wisdom teeth. And you'd be amazed at the number of people that I see on consultations that just a routine x-ray their general dentist did, and they're missing 3/4 of the jaw because of a cyst. And teeth develop in the bone, in the jawbone, as we are, children, and they develop in something called a follicle, and it's almost like a little eggshell. And as the tooth erupts into the mouth, the follicle breaks open and goes away. But if you can, again, think you've got an impacted tooth, and that tooth can't erupt, now what you get is called cystic degeneration of the follicle, where the follicle begins to grow, and it becomes a cyst, and the pressure of the cyst takes away the bone. So there you go. Admission to the hospital, taking it to the operating room, taking out the wisdom tooth, scraping out the cyst, bone grafting the jaw. So they can cause problems. As I say, I won't go into all the problems, but the big thing is you don't want to mess up your kid's orthodontics.
Yes, indeed. Now, that leads me to ask you, Dr.
Sure.
Emmett, what age would you recommend for someone to have their wisdom tooth extracted?
Right.
And I preface that by saying, obviously, I'm sure it depends on each individual, but in general terms, what are people looking at?
Well, that's a real good question. And the main recommendation by the American Association of Oral and Maxillofacial Surgeons is anywhere between the ages of 15 to 25. Okay. That's a really nice period there. But you have to recognize that some 15-year-olds are going to have wisdom teeth that normally would be an 18-year-old, and some 15-year-olds are going to have wisdom teeth that are going to look like a 12-year-old. So people develop and mature at different rates, especially dentally. If there's indication from a clinical exam and from a radiographic examination, in that ballpark is a really good time. I find that kids younger than this don't tolerate the anesthesia quite as well as the older teenagers or the younger adults. As you get beyond 25, healing is much slower. The risk of complication is higher, and if you get a complication, getting through that complication is much more difficult than it is when you're younger. I mean, you can admit, I can admit that we don't heal like we used to.
That's right.
I'm 51 years old, and I know I don't heal like I.
And I'm right there with you, Dr.
There you go. There you go.
Right.
So earlier is better. I mean, I can tell you, it becomes a nightmare if somebody gets we get a 50, 60, 70-year-old person with an infected wisdom tooth, and it's very, very difficult, and they're making a lot of post-operative follow-up visits with me.
Yes. Well, I appreciate you letting us know that. So 15 to 25 years old in general.
In general, that is correct.
And how is the wisdom tooth removed? What is somebody looking at?
Right. Well, it's interesting you should mention that. We did a couple of clinical videos today, and one person who had 2 wisdom teeth removed from the lower jaw chose just to do local anesthesia, which is simply injections of 2% xylocaine, 1 to 100,000 epinephrine, in the vernacular Novocaine. Okay, and it's difficult to do it that way because there's a lot of pressure involved in taking wisdom teeth out. On the other hand, our second clinical video was of a young lady who chose to have her wisdom tooth removed with a conscious sedation or an IV sedation or borderline general anesthesia, deep sedation. That is typically the way that wisdom teeth are removed, for the fact that there is a lot of pressure, there is a lot of noise. We use larger drills to remove a bit of bone from around the wisdom tooth if it is impacted, and then section the tooth into pieces to get it out. So, as you can imagine, it's not a real pleasant procedure to have simply local anesthesia. Now, with easy wisdom teeth, sometimes we recommend simply nitrous oxide sedation, and nitrous oxide is laughing gas. To the layperson, they've heard it as laughing gas, and that's another option to do. But generally, with intravenous sedation or deep sedation is the way that we take wisdom teeth out. And of course, you've got to recognize that once the patient is sedated with the intravenous medication, we also use local anesthesia. It's not just the intravenous medication, but we use local anesthesia. The nice thing about the deep sedations is that the patient doesn't remember anything. So once we sedate them and we're monitoring them completely, we use the local anesthesia, and once they get numb, we take the teeth out, and they have no problems, no recollection, and it's a pleasant procedure. The majority of patients, you tap them on the shoulder, they're very responsive, and you tell them it's over, and they open their eyes and they say, "You're kidding." So that's normally the way it's done.
We're now going to meet a couple of patients of Dr. Emmett. Welcome, Jillian.
Hi, thanks for having me.
Oh, it's our pleasure. We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I wanted to begin by asking you, Jillian, what brought you to Dr. Emmett? What oral or dental problem were you experiencing?
I had impacted wisdom teeth, and they were very painful.
Oh, so obviously we all know how painful they can be. So that brought you here, and
Yes.
And then what happened?
Well, he walked me through it. He told me exactly what was going to happen, which was good because I was very apprehensive.
Yes.
As you can imagine. And he told me what was going to, what to expect and what I would be dealing with after the fact. And I felt very comfortable by the time we were done with our visit.
Oh, I'm happy to hear that. So then it was taken care of, and it's been removed, and obviously that pain is gone.
I feel so much better. I can't even tell you. If I ever have any problems in the future, I will definitely be coming here.
Well, that's certainly good to know. You and a lot of other patients that we've talked to.
Yes.
And how long have you been a patient of Dr. Emmett?
I had my surgery in April.
Oh, so okay.
It was recent.
Oh, okay. Very good. And for the folks out there that are watching, again, what would you tell them about your experience with the staff and Dr. Emmett and everybody here?
Just simply that I was comfortable. I felt at ease and I never worried. It was a nice experience, really.
Well, on that note, I'd like to thank you, Jillian, for joining us and being a guest on our program.
Thank you for having me.
Thank you for coming down.
Okay.
Welcome, Adam.
Welcome, thank you. I'm glad to be here.
It's our pleasure to have you on as well. And I wanted to ask you the same question that I began Jillian's interview with, and that is, what dental problem or problems were you experiencing that brought you to Dr. Emmett?
I had to get all 4 of my wisdom teeth removed, actually. So.
Oh,
yeah.
my goodness, all 4 of them?
Yeah, the whole shebang.
Oh, now did you you had discomfort? Is that what it was?
It was slow discomfort. Over time, they told me I'd eventually have to get them removed. So I thought, what better time than now? So didn't want to keep hunting it down the road, but
sure,
finally get it taken care of.
All right, and was it all taken care of in one sitting, or did
one sitting? It was nice and easy. It all worked out pretty well. So.
And what would you tell the viewers out there that are watching of your experience here with Dr. Emmett and his staff?
It was fantastic. They're very transparent, so they really tell you what to expect before, during, and after. So no surprises or curveballs thrown at you. So felt very comfortable knowing what exactly was going to happen.
And obviously you seem very pleased.
Yeah, it's 4 less teeth, so I think I'm a little more aerodynamic now, but
that's right.
It's working out.
You're moving a little quicker.
Yeah, just a little bit.
That's right. Well, on that note, I'd like to thank you as well, Adam, for coming down and sharing your experience with us.
All right, thank you. It was a pleasure.
Our pleasure. Now, Doctor, we've heard of the term dry socket. And I wanted to ask you, what problems does that create? And what is that for folks out there watching who may not know what it is?
Sure. That's a good question, because probably the dry socket is the most common complication associated with wisdom tooth removal. Dry sockets normally happen in the lower jaw, and basically what they are is, if I'll take you back to the extraction. So what I do is, the tooth is here, I take the tooth out. Now in that socket, you have an empty socket.
Yes.
Socket fills up with a blood clot. Okay? The blood clot is very protective of the socket. Now we suture over, okay, suture the gums on top, so you don't recognize there is a blood clot there.
Yeah.
But some things, in particular smokers, okay, whereas if you can think of the negative pressure that taking a puff of a cigarette,
Yes.
or sucking through a straw,
Yes.
okay, or
Yes.
some people that possibly could get nauseated afterwards and vomit. Other things would be rinsing out too early when that clot is not mature. Now, it typically will take 48 hours for that clot to mature. But if that clot is lost by smoking or sucking through a straw or too much activity, my wisdom teeth patients, I tell them there's no activity. 48 hours, you're at home. I tell the kids, I say, you're at home playing video games or watching movies and eating ice cream. Can you do that for 48 hours? Most of them get a big smile on their face.
They're going to love that.
Right, and so you take it easy, you let the clots form. If you lose the clot, now what we have is an open bony hole in the jaw. Okay. And every time you take a sip of cold water or a sip of warm coffee, it hurts like the dickens. And it takes usually about 2 to 3 weeks of the patient returning to your office on an every other day or every third day basis, where I will have to take a medicated gauze and pack it into the socket. Okay. And that it's a great treatment because it takes the pain away immediately.
Gotcha.
But the medication is called eugenol, and eugenol actually is clove oil, and we've been using it in dentistry for 300 years. Immediate pain relief, but just if you can imagine having to come into my office, every third day for 3 weeks while I'm packing that socket, and how much, it affects the taste of your food. And it's incredibly annoying. And the way it heals is the socket now, because you don't have the clot, the way the socket heals now is from the bottom up. So it's just slow, 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 slow.
Very interesting.
That's a dry socket.
Okay, I appreciate that.
Not a problem.
And I wanted to ask you, Dr. Emmett, what would you say, and again, I'm sure it varies patient to patient, but on average, what would you say is a typical recovery time from a wisdom tooth extraction?
Typically I tell the kids, again, the 48 hours, they're in the house and they're not doing anything. That third day they can get back to, regular daily activities. I'm not talking about lacrosse or field hockey or anything like that. The fourth day, I basically let people go back to the gym and start their running and things like that if they feel like they're able to. So complete normal activity at day 4, okay, to day 5. Are they 100% at day 4 or day 5? Usually not, but they certainly are back to work, and they might have a little bit of soreness. As far as swelling goes, it's kind of remarkable because I talk to my patients in the evening, and I call them, see how they're doing, and they say, well, I'm doing great because I'm not swollen at all. They're still numb from the long-acting Novocaine. And I'm doing great. I have no swelling whatsoever. I say, are you icing? And they say, yes, I am icing. I say, because the swelling's going to be tomorrow. That's when they get swollen on day 2. They ice through day 2, even into day 3.
Yes.
By day 4, the swelling is primarily gone.
Okay.
Maybe a teeny puffiness, but gone. As far as food intake goes, softer food, I let my patients go back to normal food as quickly as they can. Normally, the patients come back and they will say, at day 4, they're eating regular food. We restrict things like popcorn and peanuts and Doritos and hard pretzels, these types of things for 2 to 3 weeks.
Okay.
afterwards.
No, that's certainly good to know. So
Yeah.
it gives us an understanding of
Yeah, sure.
what it's like afterwards.
Right, right. And I think that's primarily the reason we do the majority of our wisdom teeth removals during November, Thanksgiving, December, Christmas break, and June, July, and August.
When things are a bit slower or there's some downtime.
Well, the kids are
possibilities.
home from college.
Yes, that's
the
right.
kids are home from college,
That's
and they're
right.
home, from high school, and they have time that they can stay at home for a couple days.
That's
and
right.
recover.
Oh, I appreciate that, Dr. Emmett. And we're literally out of time, but I wanted to ask you, before I let you go, you and your practice here in Towson, Maryland, have certainly established a very strong reputation for excellence. You're certainly recognized as not only one of Baltimore's top oral and maxillofacial surgeons, I would say you're well recognized throughout this region, and that includes a lot of territory as one of this area's top doctors. And I wanted to ask you, what would you say helps separate you and your practice apart from so many of the other oral and maxillofacial surgeons in the region?
I think that's a fair question. I appreciate the accolades. That's very, very kind of you. I think the big thing that separates me from a lot of the other guys is that, number one, I'm by myself, okay? I've always been, I was raised to be a very empathetic person towards others. My patients recognize that. I don't rush anything. That is probably one of my problems, that I don't rush, and then I get backed up during the day, and I do run a little bit behind on most days. But I'm not going to rush anybody, because they're scared when they come in to see me, and I want to make it the best experience that they've had.
Yes.
They're not rushed through. These conglomerate oral and maxillofacial surgery practices with 5 and 6 and 8 oral surgeons in 3 or 4 locations, their overhead is such that they've got to move patients through. They've got to work as fast as they can. They've got to have as many employees as they can to take care of the patients, and there's very little doctor-patient care. It's mostly assistant or anesthetist care for the patient. And they see that. I hear it all the time. With many of the larger groups. But empathetic care, as I say, my patients get phone calls in the evening. I've been doing that for 20 years, and that's a big practice maker.
Yes.
Somebody the doc calls at night just to check on you.
It's like it used to be at one time, and you don't see too often, but that's that old school part which is so much needed and so important.
It's important to me.
Yes.
It's important to me, because that's my reputation.
Yes, indeed. And when you mentioned patients come scared, that's the case with any dentist or oral or maxillofacial surgeon they go to, because one of the biggest fears, as we all know, of most people in society is going to the dentist. So they come with that anxiety and that fear to some extent, and you and your wonderful staff here, we've had you on before. Our research, over the years has certainly confirmed this over and over. You all really take care of each and every individual patient that comes through that door as if they're a family member. And as you just touched on, you even call them after hours to make sure that everything is okay. And that's something that I think is just so rare in today's day and age. I've interviewed so many dentists and oral surgeons and other type of specialists, hundreds of them over the last several years. And I must say, Dr. Emmett, I think I really commend you for that, because that shows a lot about you as a person, not to mention how you and your practice are and how you take care and go that extra mile to make sure your patients are very happy and taken care of.
Well, thank you again. I do appreciate that, but I figure they're here they're going to pay for a service, or their insurance is going to pay for a service, and that's the way I am, to work, work hard to make them satisfied patients.
Well, I can certainly see how you've earned that reputation over the years. And on that note, I'd like to thank you for joining us again, being a guest, and certainly educating us on all that's involved with wisdom tooth extraction. Thank you, Dr. Emmett.
Thank you for having me again. I appreciate it.
It was our pleasure. We'd love to have you back on in the future.
I'm sure there'll be plenty of opportunities.
Yes.